get your DVD orders in today for $100 off. Omar Amin, yes, he is originally from Egypt, and he is now the director of the Institute for Parasitic Diseases, which is headquartered in Arizona with branches in New Mexico and West Africa. He's gone to medical school in Arizona and in England. He's been all over the world, many different countries. I didn't actually write down the number, but it was an awful lot. And he has 180 major publications on the subject of parasites. So let's please give a warm welcome to Dr. Omar Amin.
Thank you for being here. I understand I have to speak up because I normally am a soft-spoken person and I do not have the modern equipment to do much better. I'll try to speak up. If there's any problem with the accent, don't worry about it. I'll get accustomed to your accent very quickly. We have 4 offices and clinical facilities in Mexico, not in Mexico, and in West Africa. But our main operation is in Arizona. We work with parasite diseases and infections and other infectious agents, primarily on human beings as well as on wildlife forms that can be reservoirs for human infections in turn. Before I get started, I want to emphasize the point that what about parasites in the United States? We are such a wonderful, progressive, antiseptic society with parasites is not part of our panorama of agents that affect our lives. You could not be any more wrong. You do not teach parasites in medical school. Doctors here in this country do not know parasites, and I get some of the most naive interpretations of a patient's symptom from medical doctors that should know better. So it's not a great service which is being done to the average patient as seen by a typical classical AMA practitioner. We need to know better. Parasites can affect the human body in one of 3 possible ways. First, either directly by actual destructive physical action that tends to destroy human tissue. Secondly, by the byproducts, the metabolic byproducts of the parasites that can affect and initiate an allergic reaction on the part of the patient, which can affect the neurological system as well as the dermatological skin system. And thirdly, when the parasites cause damage in the body tries to repair the damaged tissue by proliferating at a faster rate than its normal rate of proliferation. And as a result, when that rate of proliferation or compensation of damaged tissue occurs at a faster than the normal range, when it goes out of control, the tissue can become metastatic and cancer will ensue. There are many known cancer cases, especially in Africa and in the Indian subcontinent, in the intestinal tract and the liver, depending on the presence of parasites in these organs, that the reproductive ability has gone haywire. So this is the kind of thing that we're going to talk to you about today, by showing the actual picture. Those that have weak stomachs, if you want to take off and leave the room now, because I'll show some pictures that you do not want to see, especially before lunch. But we'll take it as it comes. In our facility, PCI, Parasitology Center in Arizona, we train also foreign doctors. Those are pictures of a couple of physicians. The left from the gentleman from Mali, West Africa, where I have my 3rd facility, and the gentleman to the right is from Ecuador. And this is kind of like the services that we offer in our center. It's not a small center, but it's a very efficient center. Why test for parasites? That's the kind of symptoms that you can get if you get any one or more of these symptoms, then you want to suspect or think parasites and to start doing something about it. The GI symptoms on the left-hand side here. And there are symptoms that occur outside the intestinal tract that all are byproducts of the parasite infections. How do you get infected with parasites? What is the common exposure? Parasites are all invariably preventable diseases, as the case is with most cancers are preventable diseases, their function of exposure. Get affected by drinking water, skin contact with contaminated water such as in swimming or wading, food ingestion with contaminated food items, whether it is food or drink or juice or whatever the case may be. Arthropods, ticks, Lyme disease, plague, typhus, caused by fleas and lice. Air, upper respiratory tract infection can cause viruses and bacteria. Valley fever in Arizona is quite common, and hantavirus, you know about that. Pets, dog is not the man's best friend. Dog can be your absolute worst enemy, depending on your nature of exposure and contact with dogs. Interkissing with dogs with children can cause very serious illnesses, especially tinea. People, contagious disease, AIDS, herpes, and soil, hookworms and threadworms. If you walk barefoot in an area which is soiled by infective stages of any one of these nematode species, it can go into your skin, goes through two migratory cycles involving the liver and the spleen and the heart, and sometimes also quite often the respiratory system. And when a patient comes into your office and he has hard time breathing and the diaphragm isn't working right and so on, don't always suspect some magic things. Think of parasites also. Parasites can compromise the diaphragm and the respiratory system as part of the migratory cycle in the human body, and as a result, patients should always be tested for parasites. I just mind you, have some friends in Sweden that test their horses for worms once a year. I think we deserve better than horses in Sweden. Many of the doctors I work with test their patients for parasites routinely once a year with an annual checkup. I do not want to bother you with the techniques of how to process and test the samples because we only have time limitations. We have more interesting things to share with you. So I'm just going to quickly overlook the process that we do in the laboratory to test for the parasites. This is one paper that I published in the American Journal of Tropical Medicine and Hygiene, which shows that of 5,700 fecal specimens examined from 48 states, 19 species of parasites were recovered, and the most common of those species, Blastocysts. Also notice that, let's see, 32%, sample is written here, 32% of the persons examined were infected with parasites. Infection, prevalence of infection was 22-27 in the winter, but increased to 36-43 in July and October, basically amounting to average of 32% of the people sampled in those 6,000 or so cases were infected with parasites. If these results apply to you here sitting in this room, then look around you, right and left. The chances are 1 out of each 3 of you sitting in this room is infected with parasites. You may know it, you may not know it, you may have clinical infections, you may have clinical symptoms, you may be subclinical, but if you have any of the symptoms I showed earlier, then you need to be checked for parasites. By the way, I should mention that I have some flyers and cards in the registration table if you need to check. We compiled a list of herbal remedies that would be used for parasites. We are more into herbal remedies and homeopathic remedies and so on. We do not like antibiotics. So this publication here in Explore magazine lists every single herbal remedy for parasite that was invented since ancient Egyptian, ancient Chinese remedies were known in the literature. And it has recommendations for doses for children and doses for adults. I also have a video 5 or 6 part video on parasites, which is now being taught in medical schools and in graduate schools. The first parasite, which is the most common in the United States. 2/3 of infections of the United States average population is of Blastocystis hominis. It is a single cell protozoa, had nuclei on the outside of the fringes. Infection is caused by fecal oral contamination. It has intestinal and extraintestinal symptoms, including skin abnormalities. I worked for the very famous movie star in Hollywood. I'm not going to mention her name, obviously, that was a version committing suicide because she had those huge skin problems that she could not shoot pictures. Halfway the picture was destroyed. She could not shoot the rest of the picture, and she was just home, cooped up for about 2 or 3 months in a row. The film production stopped, and she was just out of the blues. She found my number. She called me up. And I told her, send us a fecal specimen. She said, what does the fecal have to do with my skin? I told her, just send us a fecal specimen. She sent the fecal specimen. She has a Blastocystis hominis infection. She was treated, and in 1 week, her skin was back to normal. She calls me my God. So I told her, don't push it. But anyway, those things happen. This is the secondary manifestation in the system outside of the intestinal tract, as a result of the toxicity, which is natural byproduct of the parasite, to which the patient may be allergic. This is a case of heavy infection with blastocystic organisms, and they will elicit a reaction in the intestinal gut if you see them producing such heavy mucus presence. The body produces mucus to attempt to coat the intestinal lining from the damaging effect of the parasites. So with an infection like this, you expect to get death. Cryptosporidium parvum is the second most common parasite in the United States. We've also published on that parasite. Our prevalence is 13%, while the average prevalence rate published in North American laboratories is 2 to 4%. It is a small microscopic single-cell organism, about 2 to 5 microns in diameter, 2 to 5 1,000ths of a millimeter. It is present in water, and you get it by drinking contaminated water. Most people drink water from bottles. But please note that published studies have shown that 20 to 25%, roughly on average, I hope I remember the figure correctly, of U.S. households that are serviced by surface water treatment plants are naturally contaminated with spores of Cryptosporidium and cysts of Giardia. If you are in a city, which you can check with your city health department, if you are in a city that is serviced by surface water treatment plant, the chances are 1 out of each 5 households have natural infection, contamination of their tap water with Cryptosporidium and also of Giardia. So something you want to check with your city health department. Cyclospora is similar to Cryptosporidium. It is claimed that Cyclospora infections come only from South America with the Chilean grapes, and that because we are such a beautiful, healthy, antiseptic society, we do not have this. We always tend to blame other countries and other nations for our ills. I have published a paper, which is that paper here, which confirms that Cyclospora catanensis does have a cycle in water treatment plants in the Valley of the Sun in Arizona, and that you can get it through tap water also, same as you would get Cryptosporidium parvum. It is not only in grapes from South America. It has since been, after this publication, this has since been reported from vegetables and produce that have been washed by such water, and that if you do not wash your produce very well when you bring it from the store home, then you are perhaps maybe asking for trouble. Anthraquinella histolytica is often called Montezuma's revenge because of the bloody diarrhea that it causes. This is the trophozoite. This is the cyst stage, and this is the trophozoite. Trophozoite is the actively feeding stage that feeds on your intestinal lining. It goes through a number of generations in your intestinal lining, and somehow, no one knows when or why, it stops dividing and migrates through the blood system to the liver and causes hepatic problems. I'm going to show you pictures of some gross pathology of this in a few moments. But then after that, it will tend to leave the body as a cyst. It can survive as a cyst in the dry fecal outside the body for up to 3 months. The cyst has a thick cyst wall, which prevents it from desiccating, so it stays alive within the cyst wall. You can see the thick cyst wall here. Okay? And then it can reinfect by contamination. For people like us that live in Arizona or all the states that border Mexico, you should be aware that our fresh produce, 50% of it year-round on the average comes from Mexico, which is famous for fertilizing vegetables and produce using human waste, and that can be a source for contamination. So you have to be extremely careful 100% of the time in cleaning your fresh produce properly before you put it into your salad or whatever the case may be. Amoeba histolytica also feeds on, here's trophozoite, and here is some food items that the trophozoite has eaten. This is the nucleus of the trophozoite. And among the food items that this organism feeds on in the human body is the white blood cells. When the white blood cells are destroyed, the protoplasm crystallizes into these so-called chocolate-coated crystals. And because this organism is cyclic, that is, it does not present in the fresh stool every day, every time you go to the bathroom, it presents about 2 or 3 days a week. So sometimes it is not detected in fecal stool examination, because if the collection of the stool occurred at a time when it was not in cycle, then the stool specimen would look negative. But if you find that crystal in the stool, you can tell that this is there, and you can treat for the organism, even though you have not seen the actual organism, you have only seen the crystal alone. So this is called like a telltale sign of the presence of an organism that you cannot see directly as such. This is the surface of the intestinal lining, showing the spot holes caused by the invasion of the amoeba into the intestinal lining. And this is a histological section of one of the spot holes. Here it is, the spot hole that shows the extension of the parasite and the tissue destruction under the intestinal lining. This is the serosa layer by the body cavity. This is the lining, the intestinal lumen right here, and this is the destruction here right here. And after a while, those areas of destruction coalesce, they connect, and the whole layer of the intestinal lining is shed off, becomes exposed, and very susceptible to secondary bacterial infection, which can initiate cancer in most cases. People who get intestinal cancer that premeditated by a parasite infection starts off in this way. You can have, here's a colon from autopsy material, showing secondary bacterial infection that is white after the damage by the Amoeba histolytica, and this is an infection that extends into the anal orifice here. It's called rectal mucocutaneous amoebiasis. This is a child, it's a 4-year-old child that had liver badly affected. Here is the child, when this child was autopsied, This is the area of the liver that you can see here marked with chart on the abdomen. It is about twice the size of the normal liver, and when that is cut open, here is the liver of the child here. You can see it very large. When it's cut in half and sectioned, you can see the parasites in it very quite often. The parasite also becomes bloodborne. When it goes to the liver, becomes bloodborne, migrates everywhere in the body. Here, it migrated to the brain of this person, and the person can have brain problems and can die from abscess in the liver. From a parasite infection that starts out in the gut or in the gut. Amoeba coli is another organism which is like Amoeba histolytica, except that this one is not pathogenic. It may cause some diarrhea and some dermatological symptoms, but not often. It has the same life cycle also, but does not invade the liver, while histolytica does invade the liver. Giardia is very common in Russia, especially in the Leningrad area. Actually, the first worldwide outbreak of Giardia in the world was in a group of American nurses that were touring the city of Leningrad about 20-25 years ago or so, and they practically all came down with Giardia infections. Brought it with them in the United States, and they started what we call an important focus of disease in the United States. Here are the cysts, which is the stage that exits the human body to infect another person, and those are the feeding stages called trophozones. The main trouble with Giardia, other than its normal GI symptoms, is the fact that it does cause problems with the assimilation of food. The phenomena is called malabsorption. You cannot digest your food remains undigested, so you keep piling all this food in, but you're still thin like a wire. Also, it even becomes more serious when you cannot assimilate or digest or utilize the medication that you're using for it becomes not absorbed either. So it becomes non-effective. That's why Giardia is very hard to treat. Violent coli is a disease of swine and usually affects people that work in swine farms by accidental contamination or soiling of hands from dealing with swine material, and then the human being suffers much more. Swine don't even know what's happening. They're not affected whatsoever. It's not pathogenic in swine, but it's highly pathogenic in humans that are accidentally infected on the job. Those are species of parasites in the line like Snana, Amoeba, Amoeba, and Chylomastix, which have often been reported in the literature as not pathogenic. Don't worry if you have them, don't treat, it's not harmful, don't bother, but you couldn't be all around, because in most cases it's probably true. However, people that are susceptible, people that do not have a competent immune system, will suffer seriously in the GI system, and on occasions outside of the GI system by chronic fatigue for the most part. Chronic fatigue is an enigma. It can be caused by a wide variety of reasons. One of them is parasites. These are when you do benchtop parasitology, when your job is trying to identify parasites for diagnostic purposes. Quite often you see things that can be confused by the unprofessional eye as parasites, but they are not parasites. They are called artifacts. So those are the artifacts that we need to watch for, not to be confused by parasites. Red blood cells, white blood cells, squamous epithelial cells, columnar epithelial cells, red blood cells. Candida is common. Geotrichum is a common fungus, it's not a parasite. Yeast infection, another fungus called Alternaria. Citrus particles are confused as worms. Bean sprouts are confused as worms. Tomato skin is confused as a long tapeworm, and the same with mucus casts. Mushroom spores are confused as nematode eggs. Pollen grains are confused as eggs of ascaris. Plant parasite, Heterodira, is not a human parasite. And mite eggs can be accidentally. You know, most homes have dust mites. You inhale these quite often. We all have mites under our eyelids, whether you like it or not. They don't look so hot, but we all have them. They look like little mini sheep. But they're very minute, few microns long. We all have them, no exceptions. Antibiotic crystals. This is something that we can catch a patient on because we require in our test kits that when they collect the stool sample, they should not be on antibiotics. Being on antibiotics compromises the test results. So when we see these crystals in the stool sample, we know that the patient lied, they were on antibiotics, so we disqualify the sample. Okay. Fatty acid crystals. Usually you have problem with gallbladder. When we find these, we recommend the doctor examine the functionality of the patient's gallbladder. So the gallbladder produces the gall, which its main function is fatty acid metabolism. When we see too much of this in the stool, we know that fatty acids are not metabolized properly. So that calls for a check with the gallbladder. We have those telltale signs which have nothing to do with parasites, that we also give directions to the doctors to examine. Plant hairs and of course potatoes. You can actually tell what the patient had for dinner the night before by identifying what kind of food items there are that are remain undigested in the stomach. Those are potato Non-intestinal protozoans include Trichomonas vaginalis. Most of you know Trichomonas vaginalis as the cause of non-specific vaginitis, which is the case. It is present in men. It's actually transmitted to women by men, but men are not affected by it, but women will have vaginitis from it. Sometimes when that is compounded with can be the albicans, you can see this serous exudation, creamy discharge in the vaginal structure of infected women. Flagellated non-intestinal protozoa. We see some of this in Arizona and in southern of Texas, but they're much more common in Central and South America. There are two species, one in Mexico and one further on in South America, called Mucocutaneous leishmaniasis. The species of this leishmaniasis is a single-cell protozoa that is flagellated with a tail. Infection is transmitted by the bite of a sandfly. Sandfly is like a mosquito. It's about half the size of a mosquito. It will acquire the infection from a wildlife form, the rodents usually, and then will enter. Mosquitoes never satisfied. They will finish their meal using some other warm-blooded animal. In this case, if it is you, then the infection acquired from the rodent is transmitted to you, and then you suffer from the liver, spleen, and in the skin. Even though it is mucocutaneous leishmaniasis, that is usually affects the mucocutaneous structure like the mouth opening and the oral cavity, or also non-mucous structures can be affected. This person here, I don't know how well you can see the mouth opening that have completely eroded, and it's caused a secondary bacterial infection. There's no cure for this short of corrective surgery. But most of these patients in the wild woods of South America have no access to medical facilities to do corrective surgery, cost and everything else. So they live like this until they die. Mostly they die from the secondary bacterial infection rather than from the actual leishmaniasis infection in the first place. This disease that is beginning to show into the southern rim of the southern states bordering the country of Mexico. I've seen few cases the last few years. Trypanosoma cruzi, another. How many of you have heard about Chagas disease? Chagas disease is in the tropical rainforests of South America. transmitted by this bug here. It's called assassin bug or kissing bug. The bug is about 1 to 2 inches long. You cannot miss it. But they're very clever. They bite at night, and they somehow manage to avoid the nerve endings on the skin. I don't know how if it's deliberate action or just accidental. Because when they bite, you don't feel the bite, as large as they are. You don't feel the bite. And they bite at night when you sleep anyway. But they usually recollect them from the small straw huts in these areas, in the woods, at the edge of the woods. That's where the most predominant are. The reservoirs are opossums, raccoons, and large rodents. They take the infection from here, they split the human there. That's where they are found in South America. And the first initial appearance of symptoms occur in the eye orbits, called periorbital edema. You see the eye orbit showing big, heavy inflammation. So you need to look, once you see that, you need to look into the liver and the spleen and the heart. In chronic cases, the heart becomes twice as large. It becomes fibrotic. That is, the muscle tone of the heart is lost and replaced by fibrotic tissue, which is the body's natural way of compensation for loss of muscle tone. It produces more fibrosis, and when that happens, fibrotic tissue does not expand and relax with the heartbeat as it should, so it fills up with blood and does not pulse properly, and hence it becomes large in size as such. Right? And then this and then, of course, patients will eventually die from heart disease, not because of pressure on the job or a fight with the wife. It is usually from fibrotic tissue formation in heart tissue as such. And then also you have the megacolon, which is another byproduct, where the colon becomes twice as large, and quite often the rectum prolapses outside of the anal opening. It just falls out as part of the enlargement. There's no place to accommodate the colon anymore, so the whole digestive system, the lower part, evacuates outside of the anal opening. I should mention that there are 32 states of continental United States that have this bug in it. And in all the United States, we have the opossum, we have the raccoon, especially in the Midwest. We have all the natural ingredients that would make of this a serious U.S. epidemic. What we don't have much of as of yet is the actual pathogen in the host that would naturally come to us with immigrant labor force coming into the United States from South America. That is the only element that is needed to make from this a very serious epidemic in the United States. And I anticipate this is going to be the thing for the public health service to look for in the future. This is a disease that is waiting to happen. Toxoplasma gondii. Those of you that have cats. Cats are next to dogs as far as man's best friends. Especially if you live in the northern states of the United States, where cats stay indoors quite often in the winter, and their feces are not at least replaced and cleaned at least twice a week. The spores in the feces of cats, of toxo, become infective 3 to 4 days after they're eliminated in the cat feces. So the cat litter has to be cleaned at least minimum twice a week, preferably 3 times a week, to prevent the feces, if they are infected, for the infection not to reach the infective state, physiological infective state to human beings. Women which have toxo can cause genetic deformity in their children, and as opposed to measles. And so they say measles, if you have measles infection in the first or the second trimester of pregnancy, the offspring will be affected. In the case of toxo, it's usually the third trimester that becomes infected with the newly born child. as far as toxoplasmosis. Nematode infection, Ascaris. Ascaris is the first most common worm infection. We talked about single cell infections before, but in the United States, it is the first most common worm infection. The egg is the conveyance stage. You get infected by the egg, or the egg is accidentally inhaled. There was an epidemic in Germany during the Second World War of Ascaris infections, and in one city, I forgot the name of it, right offhand, they said they recovered Ascaris eggs off the banknotes, of paperwork, garbage in the street. It was so prevalent, practically in the air, it was just so heavy. The worms are about 1 foot in length. If you give the proper medication, you can eliminate most of the load parasites, as you can see. Patients die from blockage of the intestinal tract. You can see here the bunch of worms here taking the shape of the intestine of this autopsy case. You can also block the gallbladder. In this case, this is the liver here. And not uncommonly, where the intestine loops and turns in the corners here, they tend to cut through the intestinal wall and end up in the body cavity when there's sharp curves in the intestinal wall, and they end up causing peritonitis, and the patient, if he does not die from intestinal blockage, will die from peritonitis infection. That also is a common way of damage caused by the worm. The third way that physicians here would never think of is that the migration cycle of the worm involves the following. Just picture this with me. You ingest the egg, okay, with the air or with a contaminated food item. And then the egg hatches into a small larval stage. The larval stage cuts into the intestinal wall, goes into the circulation, into the lungs, pulmonary circulation. Is small larvae in the lung tissue. And then from the lung back to the oral cavity and re-swallowed as a juvenile that reaches maturity in the gut in the second phase. All right? So the pulmonary circulation will suffer, the lungs will suffer. When you get a patient from an area that is known to have a high frequency of Ascaris infection, the patient has hard time breathing. All right? Now you should suspect Ascaris. But who of the doctors that you would go to that will think Ascaris when you have hard time breathing? You have to be conscious of the possibility of parasites in the overall epidemiology of disease and infection in the United States, which we do. Actually, our rates of infection, 1 out of each 3, is not much different than the rates of infection in many developing countries. Parasites cannot read English, they cannot read maps, they don't know the left or border lines, they go wherever they choose, and they have nothing to do with it. Here's a case that I published of a patient that died from sushi. This is the worm that we recovered from that patient. And we recovered it from his throat. It actually penetrated his esophagus and went out his neck. We just pulled it from here. And here's the case described here. So sushi, I mean, if you know sushi like I know sushi, you may want to ask me after that. Don't eat sushi from a shady place. And be careful what part of the tissue of the fish that you're eating could be liable to be infected with the worms. The worms are called anisakarisis or anisakis, and that's how the worm looks like. When you get a thick fish fillet, Fish fillets quite often are cooked to specifications by the FDA, correct temperature, 180 degrees Fahrenheit. You can measure, we've had it once, in one case that I was part of, lawsuit. But the fish fillet was so thick, came from Japan, that the outside of the fish fillet was properly cooked, but the inside was still more raw, was not touched. The person who was eating it was not infected, was cutting into the fillet, opened up and the worm started withering it off, and even though we measured the temperature of the cooking pan or have you, it was a proper temperature, there's nothing wrong. But that's the fine-tuning of the preparation of food. Ancylostoma duodenale and Necator americanus are hookworms. The worm is about maybe quarter of an inch long. They have teeth. This is the South American species, has 2 large teeth. The North American species has 3 pairs of teeth. This third one over here. This is the egg. And you get these worms by walking barefoot in an area which has been soiled by someone who has defecated in this area before you went there. Actually, any part of your body can be subject. I got a case from Hawaii for a lady that got infected through her butt because she was sitting on a beach naked in an area that was contaminated, and the worms penetrated her cheeks. The worms' main damage is the loss of blood. The worms, as small as they are, they rely on the oxygen for respiration, from oxygen from the hemoglobin of the blood. They cannot breathe. Their respiration is anaerobic. So they have to get that much hemoglobin in that much blood to extract oxygen from it for the respiratory function. They are continuously, it's like an open faucet. The continuous movement of blood from the mouth and the anus. Our mouth is a continuous flow. If you have an infection of a few hundred of these, the patient usually is very thin with a large belly. Typical emaciation of the body and a large belly. This is mention something that's kind of curious about this worm. It's like the previous worm, but however, it exercises 3 different life cycle patterns at will. It's like you have a light bulb that has 3 intensities of light. You can, every time you switch, you get different intensities, like a different light bulb. You know those light bulbs? It's like this. If the human body is a scarce resource and not available for the parasite to carry on its normal life cycle, it will opt to live as a free living worm in the soil and feed on organic debris for years on until the human presents himself. Then they start infecting the human again and they developing a parasitic life cycle. Just picture, we have in our systems, we have certain metabolic pathways. We have the cytochrome cycle that metabolizes our food that we digest. But those guys have the metabolic life cycle and they flip the switch and go to another metabolic life cycle at will when the human host is not available. So you can never kill them. Trichinella spiralis, trichinosis, infected swine, quite often not just we have a swine cookout on birthday parties. That's most direct and most eminent and most strong direct source of infection with Trichinella spiralis. Trichinosis in the muscle, trichinosis in the fingertips or sublingual splinter, trichinosis symptoms most common again around our ear, you can tell. And sometimes, more often than not, when the swine meat that is infected is mixed with meats of other cold cuts and is presented in the marketplace for sale, that can be diffused and spreads one infection into many different kinds of cold cuts. And by the way, the USA does not inspect for trichinosis. So you're on your own. I recommend always never eat pink meat. Make sure it is brown. Introbus vermicularius, the disease is a very old pinworm infection. You cannot take your child to the doctor in the morning and have him checked for pinworm infection because the chances are he's not going to ever show past it, even though he is a case. The worm retracts into the rectum and is not liable to be tested by any way other than by the Scotch tape method. You put the Scotch tape with the sticky side up on the microscope slide and stick it to the child's inner opening at night. Because that's when the worms go out. The worms go out at night. They don't go out during the day. They don't migrate to the outside during the day. And then you can get a positive Scotch tape that you can identify the worms as. And that's why it is often, I sometimes, on one occasion, I got one patient from Canada that came to visit me in Arizona. He flew his child. You could have done it at home, but he did not know that. I went to visit the child at the hotel at 3 o'clock in the morning and swabbed the child's inner opening with the help of his head on the Scotch tape to get an infection, which we got an infection. Anytime after 5 a.m. or before midnight, the worms will not be there to be sampled. So it is that magic hour that the patient can be sampled. Introbus vermicularius is an adult worm, and this is the Scotch tape method here. Trichurus trichura, or the whipworm infection, can cause prolapse of the rectum because the parasite here will invade the rectal area. The thin part of the parasite is the front part. The thick part is the posterior end of the worm. There is so many hundreds of worms infecting the rectum of this autopsy case, and they tend to feed on the nerve elements in the rectal area. The nerve elements that are responsible for heating the texture of the rectal and intestinal tract proper. So once they destroy the nerve elements, then the person has no control on the muscle arrangement of the rectum, and the rectum falls out of the anal opening because it has no muscle toning in. Diethyl latum is the longest tapeworm that we know of. It can reach the length of 30 feet, that is 10 meters. It coils back and forth, and that does not track. This is just one worm. Okay? This is the anterior end of the worm, and these are the eggs. The worms are acquired through the eating of not well-cooked fish fillets. They are very common in Northern Europe, in Norway and Sweden, and Scandinavia in general. There's a few cases in the United States. This is the United States. This is a case of, I think that's a United States case also. And if you have more than one worm in the gut, then both worms will be half the size so that they all add up to 30 feet. It's usually like a limit. That's how far the intestine can accommodate the worms. The worms will be feeding on everything that you eat so that you don't get the benefit of your food and nourishment. And most of what they feed on is vitamin B12. For some reason, they love vitamin B12. Vitamin B12 is responsible for your memory and your proper neurological function. We have a case here of a woman that we've seen a few years ago that couldn't remember anything. Lost brain fog, loss of memory, and loss of neurological functions, locomotor functions, so on, until her doctor, who she married later on because she saved her life, send us a specimen of the fecal and we identify deratum in her feces. So he gave her the proper treatment and he supplemented her heavily with B12. Her neurological functions were restored and she couldn't be happier. It took about a month, 2 months for her functions to be restored again. And now, so far as I know, they're still happily married. And you go to the doctor with loss of memory, and what does you don't think of worms in your gut. You think of giving you some neurological thing and sending you to some kind of mental hospital to see why you're not feeling right or whatever. But don't belittle the effect of parasites. Tinea solium and Tinea salignatus are also tapeworms that affect the human body. Tinea solium has the pig swine source. Tinea salignatus has this, a beef source. And the immature stage of these worms is the cyst form that can affect the human body in many places. Here is the brain cyst of Tinea solium. Here is Tinea solium in the eye. Tinea solium in the thigh of the patient. This is the thigh bone here. Okay. The immature stages live in various body tissue and they can affect and disrupt the function, proper function of these organs and organ systems. And the most of the tinea-like worms, Echinococcus granulosus, which I want to mention to you, especially if you live on the West Coast, especially if you live near an area that has a lot of sheep industry in the vicinity or around the area, and especially if your child has a dog, especially if your child exchanges kisses with the dog mouth to mouth, then you have really a problem in your hand. Let me tell you how the cycle works out. The dog has the adult worm in his gut. The dog will defecate. The eggs that are here in the worm will be around the anal orifice of the dog after defecation, correct? The dog will groom itself, will lick itself around anal and everywhere else, cleansing itself. Then will spread the egg from the anal everywhere in his body, including his fur, especially his mouth open. The child kisses the dog. The child accidentally becomes contaminated with the eggs that came from the dog's mouth, which initially came from the dog's anal, correct? The eggs in the child's body will develop into a cyst form, and the cyst enlarges and spreads and produces second generation, third generation cysts. This is the liver of the child that's cut in half. Most of the space occupied by a large third-year cyst of E. granulosus. This is a man in California in his honeymoon that died of E. granulosus. His marriage had nothing to do with it, so far as I know. But his liver is cut in half, as you can see, and you can see the liver is lined with, again, another third-year cyst of E. granulosus. And this is a scan of that cyst in that same case here. Serious outcome from the very simple thing that you can observe by keeping hygienic measure observed when the dog is involved, especially when little children are around. It's called hydatid disease or hydatosis. Those are other tapeworm infections that occur from other tapeworms usually acquired from involving rodents and then cereals. Rodents invade grains and granaries and you make cereals from those things. And cereal can have infective stages of the tapeworms accidentally contaminating your food. That agent caninum is a tapeworm of the dog. transmitted to the dog and from the dog to human being by a flea infection. S. mansoni is a common disease in Africa and in Mexico and in Southeast Asia. The closest thing I came to in Arizona here is a case of Vietnamese immigrants that came into California and sent a fecal sample. We found the egg of that parasite in it. It is in this part of South America here. It is predominantly African. I don't want to go into the many different species of it, but the life cycle involves a snail in the water, adult male and female that live in the hepatic portal system in our bodies. The circulatory system that is between our liver and our intestinal tract. The eggs paves its way through our live tissues, causing serious scarring to reach the intestinal tract to be eliminated with the fecal to be transmitted from one host to another. We find the parasite through the egg stage of the patient's fecal sample that is provided. Surface of the liver from that patient's autopsy. Surface of the liver. We can do a skin test like you do for TB to find out if the Giardia are present in the human body. Here's a close-up of that person. Scan. Fasciola is a parasite that is common in humans around areas where sheep are harvested. The effective stage of the metacercaria, which are on the vegetation that you can accidentally swallow, or you bring in the vegetation at home, create salads and vegetables, and you can accidentally ingest it. As you can see from the name, they are commonly found in the bile ducts and in the liver tissue of the human being. The common species in North America is Staphylococcus bascai, and also in the Far East. North America by immigration, but mostly endemically in the Far East. That's the areas where it's normally present. Also, metacercaria, infective stage on water plants, and the world is very large here, as you can see. It's present in the intestinal tract rather than the liver, as the case in Fasciola hepatica. Insects and arthropods are common sources of damage, not just by themselves alone causing damage directly, but also as serving as intermediate hosts or reservoirs for infections that live within them. Through them, they can transmit the infections to you, such as the case which I'm sure you all know about. Plague, for instance, is transmitted by plague by flea bites to humans that have been infected originally by biting infected rodents. Examples: plague, endemic typhus. Plague comes in two different phases. The sylvatic plague, which occurs flea-rodent cycle, and then urban plague is rodent-flea cycle involving human here as an accidental host. It's called Bubonic Plague for the formation of the pubes or inflammation of the lymph glands under the armpit and in the groin area. And from there on, you can have a form that's called pneumonic plague, which is person to person through the respiratory tract. These were the common forms of plague in Europe during medieval centuries, were pneumonic plagues. Diseases transmitted by lice involve epidemic typhus. Here's the patient with epidemic typhus. You can see the mottled red brick color of the patient's body. We used to be, in the United States, we had epidemics of typhus through the mid-40s. One of the reasons for the invention of CDC, Center for Disease Control and Prevention, is to work on epidemic typhus and work on encephalitis. in the United States and work on malaria. 3 major diseases that were endemic in the United States of America until the intervention by the Centers for Disease Control in Atlanta, Georgia, that paved the way for the elimination of these tropical infectious diseases. Diseases transmitted by mosquitoes include encephalitis, filariasis, dengue fever, yellow fever. This map shows the spread of yellow fever in Africa and in South America, yellow fever mosquito, and the black vomit, which characterizes yellow fever cases. You perhaps all know about Walter Reed Army Medical Center, named after a medical officer, Walter Reed, that did infect himself with yellow fever deliberately to be the first case to observe the progression of clinical symptomology of yellow fever, because there's no literature, no information. So he was suffering and writing things down, and that's what killed him eventually. But that's how early parasitology used to practice. Thank God, not anymore. I wouldn't be here today if I was practicing those same methods. Arachnids in the United States transmit. Arachnids are ticks and mites. Ticks in the United States transmit 5 major diseases: Rocky Mountain spotted fever, Colorado tick fever, tularemia, Lyme disease, and babesiosis. This is a hard tick, female and male. The female engorges so much more blood than the males do. This is a Lyme disease, picar or site or bite of the tick. Lyme disease is one of the most misunderstood diseases. I'm sure you all know a lot about it, and you know someone who has it, and you know someone's dog who has it, among a few other sources of life. However, this characteristic characteristic sign occurs only in about 30% of the cases. Lyme disease is tested for by a test that is like Wasserman's test that used to be used for syphilis in past years. It has a lot of false positives, a lot of false negatives. You can get the same patient tested twice within 1 week. 1 week, one test will be positive, one test will be negative, so you don't know which one to take. Take it quick, it makes you feel happy. But it's still an elusive disease as far as diagnosis. It was discovered by a gentleman with the name Willie Bergdorfer. I used to work with Willie Bergdorfer, and the organ was called Bergdorfine. And used to work out at the Rocky Mountain Laboratory in Hamilton, Montana, where I used to work for some time. But that is the picture of tick-borne diseases in the United States. Soft ticks, which is another group of ticks, cause relapsing fever. This is the organ here, and you can see the name why it's called relapsing fever, because of the fever pitches that come and go for about a week to 2 weeks until the symptoms subside completely. Relapsing fever usually occur around the states in the Four Corner area, Arizona, New Mexico, California. This is part of the United States. Because that is the endemic area where only toddler's ticks are present. Mites are out there everywhere in the United States, same as they are everywhere else in the world. They cause many allergies and irritations, but there's only one disease. It's called rickettsial pox, which this mite transmits in the United States households. Usually are found in basement areas which have been closed for a while, areas which are musty and humid, are not being clean and airy and sunny and good. Spiders can cause 2 major diseases that can cause illness and fatalities in the United States. There are 2 kinds. There's the black widow spider and the brown recluse spider. Here's the black widow spider. You and this is the brown recluse spider. And other photos are hemorrhagic necrosis in photos in cases caused by brown recluse spider. This arm here, we've seen this about 1 hour after the bite. This is the same arm, the same person about 3 hours later. Those species, both species, used to be confined to southeast United States, but now they're all over the country by mechanical transmission, by vehicles accidentally being contaminated by spiders from where they have been traveling. Now they're practically throughout the whole country, for the most part. Black widow range is practically throughout, covered in yellow. And the other kinds of spiders that are creased brown recluse. And this is the end of my presentation for you, and I'll be happy to respond to questions if you have.
So for a common person like me, what practical advice can you give to minimize the danger? Wash your vegetables, don't kiss your pets. What other kinds of things, for a normal person you would say?
For washing the vegetables, I personally, because I live in Arizona, I bring in my fresh produce to the house and I soak it in the sink. For every gallon of water, 2 cups full of either vinegar or Clorox. And then soak them for about 10 to 15 minutes. And then rinse and eat. I personally prefer to just, after doing this, I steam my vegetables. If I don't eat them raw, I steam. I don't like cooked vegetables, I don't like to cook anything, so I steam my vegetables, which is a very safe way of doing the same thing also. Don't eat swine meat that is not brown. Watch for the corticals. Not inspected by USDA.
Question. There's a man by the name of Humble who developed a system with, I think it was sodium chloride and acetic acid for dealing with parasites. Is this an effective method?
Acetic acid, yes, but I don't know if sodium chloride will deal with acetic acid.
Sodium chloride.
Chloride.
Chloride, salt.
No.
Bleach. Oh, chloride, yeah. Bleach, I mentioned Clorox, yeah. Well, bleach, yeah. Bleach is very effective, yes.
Okay.
Bleach, and sometimes people that are more health oriented, they prefer to use vinegar. If you use your vinegar, use apple vinegar is better than any other kind.
Say that again.
Apple vinegar is better than any other kind of vinegar. Apple vinegar.
How about some of the traditional anti-parasitics such as cloves, wormwood, black walnut? How do you feel about those? Are they
They're
effective?
all very helpful, and there are already readily available herbal protocols in the market. I can give you some if you want to, which are good. Which I usually, when I recommend the remedies for my patients, I start out with that first, and hopefully that will take care of it.
I agree with you that physicians are undertrained in parasite discovery and diagnosis treatment, as with nutrition, a wide variety of health areas. How can I identify a physician or general practitioner that has done their homework, that has, after their education, discovered this, and what are the signs, either in their advertising or in their presentation in the office, that indicates they are parasite-wide?
You'll come across the full spectrum of physicians. There are those, like I got a telephone call last month, some doctor tells me, I do not believe in parasites. So I told him, sir, you have a problem. You need to be educated. I don't mince my words. I'm not, I may look like I'm a very nice, soft-spoken person, which I am, but when it comes to this, I'm not kind. Okay. And there are those that have used integrated practice or alternative practitioners. Naturopathic physicians are much better in this aspect than classical A&E physicians. And you can ask me, can you work with parasites?
Thank you.
Yeah.
Oregano.
2 minutes, you said?
Yeah.
2 minutes.
Last question.
I'm interested in prevention, and it strikes me that strengthening the biological terrain might be helpful, but what also about all the subclinical cases? You mentioned that's quite prevalent. Would you recommend some sort of herbal remedy for all of us maybe to undergo frequently to prevent those subclinical cases from being full blown?
Yes and no. I mean, I don't believe in over-medicating the body unless if you know what it is for. You know, so if we have good enough reason to believe that there's a reason for this, then I'll be happy to give you specific names for remedies to check out thyroid, TYLER, and those are 4 good places that produce good anti-parasitic herbal remedies that we want to consult.
Read the last one out loud.
Awarenesslife.com. Awarenesslife.com. Tyler.com, allergyresearch.com, and so on. They're all accessible on the internet, and they are good anti-parasitic herbal remedies that I work with.
Thank you. Of course, we're not taking a break as such right now because being so far behind schedule, so we're going to take as much time as it takes to set up our next speaker. It's Dr. Len Horowitz, and change all the